Oh, if you're a dog owner, you know that sound, don't you? That jingle jangle of the collar in the middle of the night, the constant scratching, licking, chewing. It can drive you and your poor dog absolutely nuts. You just feel so helpless watching them be that uncomfortable. So, what can you actually do about it? Well, today, we're going to dive right into that. We're going to explore the 4 main medications your vet might talk about to finally get your dog some relief. Yeah, this is the million-dollar question, right? You see the problem, that endless scratching, and you just want it to stop. The whole point of this explainer is to arm you with the right information so you can walk into your vet's office and have a really productive, informed chat about what's going to be the best path forward for your dog. Now, before we jump into the different drugs, we've got to get one thing straight, and it's super important. Think of these medications as powerful Band-Aids. That's a great way to put it. They're fantastic. I mean, truly lifesavers for stopping the symptom, which is the itch, but they don't magically cure the underlying allergy that's causing it. They give your dog relief, which then gives you and your vet the breathing room to figure out what the root cause is. Okay, so to understand how these medicines work, we first have to understand the enemy. We need to know what's actually going on inside your dog's body. So let's pull back the curtain and take a look at the biological chain reaction, the domino effect, that creates that miserable, overwhelming need to scratch. First up, let's get the lingo down. The fancy medical term for itching is pruritus. It sounds complicated, but it's not. So when your vet says they're prescribing an anti-pruritic medication, all they're saying is, it's an anti-itch medication. Simple as that. Now we're all on the same page. So here's the deal. Itching isn't just a random thing. It's a process. You can almost think of it like an assembly line inside what we'll call the itch factory. And on this assembly line, there are 3 key players you really need to know about. First, you've got IL-31. Think of that as the foreman who yells, "Start the itch!" Then you've got JAK. JAK is the worker on the floor, the receiver who hears that order. And finally, there's STAT, who's the messenger that runs that order up to the main office. So here's how that factory floor actually operates, step by step. The IL-31 signal shows up and connects with its receptor. That connection immediately activates the JAK receiver. JAK then turns around and activates the STAT messenger, giving it its marching orders. Get to the cell's command center, the nucleus, and tell it to make more itch. It's this exact chain of events that our medications are designed to interrupt. All right, so how do we shut down this rogue itch factory? Well, it's time to meet our 4 heroes. Each one of them has a totally unique strategy for shutting down production. And understanding these different approaches, well, that's the key to picking the right one for your dog. First up is Apoquel. Let's call this one the switch flipper. Apoquel's strategy is to go right to the source. It jumps onto that factory floor and physically blocks the JAK receiver. It's like putting earmuffs on the worker. The IL-31 foreman can scream itch all day long, but if the receiver can't hear the message, the assembly line just grinds to a halt. It's a really targeted approach. Next on the team, we have Cytopoint, our interceptor. Cytopoint's game plan is to stop the problem even earlier. It's a very specialized antibody that basically acts like a heat-seeking missile for the IL-31 itch signal. It finds it and neutralizes it before it even gets to the factory door. So if the signal never arrives, the whole process can't even begin. Then we have the old-school powerhouse, Prednisone. We'll call this one the General. Prednisone is a steroid, and it doesn't bother with a targeted strike. Nope, it uses overwhelming, broad force. It comes in and suppresses a whole bunch of molecules related to inflammation. It absolutely gets the job done, but, this less targeted carpet-bombing approach can have some collateral damage. And our final hero is Cyclosporin, the strategist. This one is totally different. It works slowly, more behind the scenes. Its target is the immune system's T cells, and its goal is to gradually dial down the body's entire allergic overreaction. So it's not a quick fix at all. It's a long-term strategic campaign to bring peace to the whole system. Okay, so 4 heroes, 4 totally different game plans. So how in the world do you and your vet decide which one to call in? Well, to figure that out, we've got to put them side by side and compare the really practical stuff. How you give them, how fast they kick in, and of course, what they cost. This table here really lays it all out. When it comes to how you give it, you're basically choosing between a daily pill, like with Apoquel or Cyclosporin, or a long-acting injection with Cytopoint. Then there's speed. Look at that. 3 of them give relief in less than a day. But our strategist, Cyclosporin, takes about a month to really get going. And finally, cost. You can see there's a pretty big range here, from the very inexpensive Prednisone up to the pricier Cyclosporin. And if we look at it this way, the difference in speed is just, wow. It's night and day, right? If your dog is absolutely miserable and needs relief now, you've got 3 amazing, fast-acting options. Cyclosporin is in a whole different category. It's built for the long haul, not for an emergency. And here's the other big factor for a lot of us, the cost. You can see right away how this breaks down. Prednisone is by far the most budget-friendly, Apoquel and Cytopoint are in that middle tier, and Cyclosporin is the premium option. This is a really important piece of the puzzle, especially if you're thinking about long-term management. Okay, cost and speed are huge, for sure. But that's not the whole story, not even close. Every single one of these medications has potential trade-offs. So now we have to talk about the really crucial stuff: side effects, warnings, and special cases you absolutely need to know about. Remember the general prednisone? All that power comes with a pretty long list of potential side effects. You'll almost certainly see more drinking, more peeing, and a dog that's suddenly starving all the time. But here's the absolute, non-negotiable, most important thing to remember. You can never give prednisone with an NSAID. That's things like Rimadyl, Metacam, or Carprofen. It dramatically increases the risk of dangerous stomach ulcers. Now for the strategist, Cyclosporin. Its main side effect is usually some tummy upset, but the big red flag here is its potential for drug interactions. It can mess with how the body processes other medications, so it is vital, absolutely essential that your vet knows every single thing your dog takes, even common stuff like ivermectin and heartworm preventatives. So what about our newer, more targeted heroes, Apoquel and Cytopoint? Well, the good news is they are generally way better tolerated. But, and this is a big but, Apoquel has a very important warning label. Do not use it in dogs under 1 year of age. And because it tinkers with the immune system, you need to have a serious talk with your vet if your dog has a history of infections or any kind of cancer. Okay, before we wrap this all up, we have to address the elephant, or the cat in the room. I know some of you are thinking, this is great, but what about my itchy cat? And that is such an important question, because what works for a dog can be completely useless or even dangerous for a cat. You cannot just mix and match. Here's a perfect example of why cats are not just small dogs. It's all about steroids and their livers. See, dogs can take prednisone, and their liver easily converts it into its active form, which is called prednisolone. But cats, their livers are just not very good at that conversion. So for them, vets just skip that step entirely and give them the active form, prednisolone, directly. It's a tiny difference in spelling, but a huge difference in effectiveness. So here it is, the final scorecard for our feline friends. Apoquel? Nope, not recommended for cats. Cytopoint? Absolutely does not work. It's actually canonized, which means it's biologically engineered specifically for dogs. Cyclosporin, on the other hand, is used all the time in cats, just at a different dose. And as we just learned, prednisolone is the steroid you want for a kitty. So after all of that, what's the bottom line? The big takeaway is this: there is no single best drug. The right choice is going to depend on your dog's unique health situation, your lifestyle, your budget, and just how badly they're itching. The whole point of all this information is to make you a better, more effective partner in making that decision with your veterinarian. You are no longer just a worried pet owner watching from the sidelines. You're an informed advocate for your best friend. You get the science, you understand the different strategies, and you know the pros and cons. You are officially part of the team. So the only question left is, armed with everything you know now, what are you going to ask your vet?